Hello everyone, welcome back to my channel. My name is Dr. Farwa Kazmi and today we are diving into a very important topic which is crucial for anyone who will be appearing in MRCEM, that is Membership of Royal College of Emergency Medicine exam. And the topic is the updates on eligibility criteria for this exam. I will walk you through what's new and what it means for you. So let us talk about the old guidelines first, and then we can talk about the new guidelines and compare the two of them. So let us talk about the duration first. What was the time duration or deadline or the number of years given by Royal College of Emergency Medicine exams previously to complete your MRCEM? And by that I mean all three parts: MRCEM primary, MRCEM intermediate, and MRCEM OSCE. Well, none. So, this is the most significant change that we have seen. Previously, there was no deadline or no limit given by the Royal College. Now, they have given us a figure, and that is 7 years. So, you will have 7 years to complete your exams. So now let's talk about the MRCEM exam. So if you have given your MRCEM primary in, let's say, June 2024, now you have up till June 2031 to complete your MRCEM, which means MRCEM primary, MRCEM SBA, MRCEM OSCE. So all three parts need to be completed. Even if you have failed an exam, you have not appeared for the exam, you did not attempt, you have not booked an exam, it does not matter. This is the deadline, the time period, the duration that you have to follow. Next up is FRCEM exam, which is fellowship exam. This is the next step after your MRCEM exam. So once you are done with your MRCEM exam, you cannot just sit and relax. No, there's another deadline waiting for you at the end of it. So once you have completed your MRCEM exam, you again have 7 years to complete your fellowship exams as well. And wait, there's another catch here. So just like once you had given your MRCEM primary exam, the countdown started for the other parts as well. Same will happen with FRCEM. Once you have given SBA or OSCE, any one of the parts and the other one is remaining, so the countdown will start again. Now, these changes might be disturbing for a lot of people, but Royal College has justified them, and let's see what they are saying. So, for a candidate who has given his or her MRCEM exam more than 7 years ago, let's say they have given MRCEM primary or MRCEM intermediate, Royal College has given them a deadline of about 24 months so that they can still complete this. So, the Royal College is justifying this by giving a time duration of 24 months or 2 years to complete the remaining parts. And same goes for FRCEM. So, if one has not done all the parts yet, they do not need to worry. Royal College will still consider those exams. They will not label them as expired or invalid, and you still have time to complete your exam. Furthermore, such people have been identified by the Royal College through the RCEM portal. So you do not need to worry about sending long emails or contacting the Royal College. They will automatically apply this update to your account, and you will be eligible to apply and to give those remaining parts for the next 2 years. So naturally, the next question that comes in our mind is, what happens if one does not complete his or her exam within the 7-year time limit? Well, for now, we do not have any answer for that, and we cannot be sure because Royal College of Emergency Medicine keeps on updating their guidelines with time. So every single day we have new guidelines to manage patients, and every now and then we have new guidelines for exam eligibility criteria and other components of exams as well. But if they have given us a deadline or a time limit, that does mean that they might label an exam as expired or invalid after that. Or the second possibility can be they might not consider those candidates as eligible as those who are fresh graduates or who are giving this exam in one go or who have cleared this exam in a recent time period, like within the last 2 to 3 years. So we're not sure what is going to happen, but we have to follow this timeline and just keep this number in your mind. And now let's move on to the next component. Now let's jump on to the actual eligibility criteria for this exam. So first I'll talk about MRCEM primary. So for MRCAM primary, there was no specific eligibility criteria previously, except for the fact that you should have a primary medical qualification that is recognized by GMC. So let us see what the new guidelines are talking about. So in the new guideline, the first component is still there that your degree should be recognized by the GMC. But there's another point which says that you should have a current medical registration. It can be provisional or it can be full registration. What this means is you should have a license to practice. So if I'm talking about Pakistan, this will be the license that will be given to you by PMDC, that is Pakistan Medical and Dental Council, or previously called PMC. And for other countries, there will be other licenses, but you should have a license, whether it is a provisional or a full license. Mind you, this was not mentioned in the last criteria, but once you applied for the MRCAM exam, there was a column and there was a form that you had to fill, and the documents that you had to provide did include this license as well. So, this new update is just a disclaimer from them. They have included this line over there. They used to ask about this previously as well. So, it should not come as a big shock to people that the guidelines have completely changed. They are just making them more clearer for people to see, because this is a very tough and competitive exam, and before, people had a lot of queries about licenses, about registrations, and they only used to get to know about it once they had applied for the exam, which means that they were midway through their application. And even a lot of people have been messaging me to ask me whether they should have a current license, and sometimes they say that their license is about to expire in the next few months. Would it be okay if they apply for the exam with that old license? No. If your license is expiring, you have to get a new license. You have to get it renewed, and then you can apply for this exam. So the Royal College is just laying out clear terminologies for you to understand that you need to have a current medical registration, which is valid on the date or the day when you apply for the exam. Let's move on to the last component that I will be discussing in this video, which is MRCAM SBA or MRCAM Single Best Answer. Now, what were the old guidelines for MRCAM SBA? The old guidelines mentioned two of the components from MRCAM Primary, which is you should have a degree that is recognized by the GMC, and secondly, you should have a license to practice. Another one which also makes sense is that you must have cleared the first part in order to be eligible for the second part. Now, the new guidelines have created this huge difference in the way people are going to be applying for the exam, because the new guideline also asks for some experience. So the new guidelines ask for 2 years or 24 months of medical experience post primary degree level, which means once you have completed your MBBS, you need to have a total of 24 months of experience to be eligible to appear for the second part. This was not the criteria previously, and as soon as you had completed your MRCAM primary, you could book MRCAM secondary or MRCAM SBA, MRCAM intermediate, and then go ahead with the third part after that. Previously, this experience of about 24 months was only asked once you had to appear for your MRCAM OSCE exam, because OSCE exam is very difficult and is the last step. By introducing this demand of having 2 years of experience before appearing in the second exam, the time lag between the first exam, then the second exam, till the completion of your MRCAM has increased. And this has significantly impacted a lot of people. But this is justified by the Royal College as a standardization procedure. And from my point of view, I think they have introduced this because a lot of people are giving this exam now. Previously, very few people used to opt for this exam. A lot of people had never heard about it. The demand for this exam and demand for emergency medicine doctors increased after COVID, because a lot of people were needed to work in the emergency. Before ending this video, I'm just going to mention that these guidelines will take into effect from 2025 and onwards. So if you are somebody who got lucky and booked their exam already in 2024, you are free from all of these criterias. And if you are planning to book your exam in the last few months of 2024, then again you are free from these new eligibility criterias. You still have to be eligible and fall within the category of the old criteria. And another very important thing I would like to mention and reiterate is you must be eligible on the date of application and not when the actual exam comes. For example, if you are giving MRCEM SBA after 2025 and your 2 years of experience, which that exam asks for, is completed in June 2025, however, you have applied for the exam in February 2025, you will not be eligible. Even though the exam is in June 2025 and you will be eligible by then, you need to be eligible on the date of application. So please keep these little things in mind. If you have any questions or queries, please leave them in the comment section below and I will get back to you as soon as I can. Have a great day.